Hi everyone. Today I'm going to present my digital agency report on the American Heart Association, presented by yours truly, Lisa Guevara. Since my early teenage years, I knew that I wanted to work in the medical field. At first, I thought I wanted to be a doctor, then a surgeon, and finally, I wanted to become a physician assistant. But in the past year, I've come across different specialties that have told me their experience. It has made me think that the specialty that I wanted to become won't be what I expect. I chose the American Heart Association because I want to learn how a person's own health can change their lives in an instant. The American Heart Association is the oldest and voluntary nonprofit organization dedicated to fighting heart disease and stroke, founded by six cardiologists in 1924. The organization includes more than 22.5 million volunteers and supporters. They created the American Heart Association because they felt like there was a need to focus on the areas of cardiovascular science, cardiovascular education, community programs, and fundraising efforts. The American Heart Association funds research fighting for stronger public health and information to save and improve lives. The organization is mostly funded by donations. Heart disease is the number one killer in the world. The disease kills more than 786,000 people. It affects 1 in every 3 adult Americans. Heart attacks occur every 30 to 40 seconds. The American Association wants to provide educated on building healthier lives, want to elaborate the importance of healthy lifestyle choices. They want all Americans to be free of cardiovascular disease and stroke. There are also the nation's leaders of CPR education training. Everyone's at risk to having a heart disease no matter who you are. There are risk factors that you are born with and cannot be changed. For example, increasing age, being born a male. Men have a higher risk of a heart attack than women do. Lastly, heredity, because children of parents with a heart disease can develop it with themselves. Things that you can be changed is having total heart cholesterol, lowering lipoprotein, having higher lipoprotein, and having a balanced fat in your body that won't increase at stroke. The American Heart Association created the Life Simple 7 to avoid heart disease. 1. Not smoking. 2. Be physically active. 3. Maintaining a healthy body weight. 4. Have a healthy diet. 5. Controlling blood pressure. 6. Controlling cholesterol. And 7. Controlling blood sugar. The American Heart Association focuses on African American and the Hispanic population because they are likely to develop heart disease earlier than everyone else. The American Heart Association have created campaigns like Go Red for Women and Power to End Stroke for African Americans. It unites African Americans to reduce the high incidence of stroke within their communities. African American women are at greater risk for cardiovascular disease. 47% of African American women have some form of heart disease. The American Heart Association awareness campaigns help Latinas make healthier lifestyles for themselves and who they love. Hispanic women are likely to develop heart disease 10 years earlier than everyone else. If you would like to know more about the American Heart Association, there are others websites that you can go to, and there's a local office in Sacramento.